Hello, welcome to my channel. So on today's video we're going to be talking about things you need to know before studying nursing in Nigeria. So if that is what you're looking for, you're at the right place. Stay tuned. So I became a registered nurse since 2018, and since then there are lots of things that I've known now. I wish I'd known them before. If I had anyone to advise me before studying, these are the things I would have done. First of all, I went through college. Information they say is power. That is so true because I never had anyone to tell me that, hey, better you go and do that in university because of certification. I went through nursing school for my nursing. If I had known, I would not have done that. I would have just gone through the university. Though many people tell you that, yeah, it's good for you to go through the nursing school so that you get the experience and all. But because of the certification, no, I would have just gone straight through the university and get my BNSC degree at once. With time, when you start the work, you eventually learn on the job. It's not easy. It's a general thing here in Nigeria, you know. Getting admission into whatsoever course is not easy, especially into nursing. It's not easy at all. So you just have to take your time. So the procedure proper. First of all, you need to be informed when the form is on sale. On being notified when the form is on sale, you buy the form. After buying the form, you wait for the names to be shortlisted for exam. Just a little tip: if your result is not complete, do not even bother registering, because it's just like you saying, I have too much money, take my money, because your name won't even be shortlisted among those to write exam. So just forget about that. So after getting the form, names for those to write exam will be shortlisted. After writing the exam, those successful will be invited for an interview. On coming for interview, those successful will now be offered admission. Some schools used to have two admission sessions. That is the first batch and then the second batch. After getting the admission, normal, you start preparing for resumption. Nursing school is a 3-year course in Nigeria here for now. I heard they are still making progress to see how to change the certification for some so that they can change the program here, but for now it's a 3 year course. So as you're going for nursing school, just keep it at the back of your mind that you're going to like a higher secondary school. You know why I say that? Because you will be well protected. There are some in this Nigeria that even say you must cut your hair. There are really much rules to be adhered to. There are many rules and regulations you have to adhere to. You have to say no to long nails. Be ready to say no to long nails. Those fancy nails, be ready to say no to them. Long hair that comes down, no. Be ready to say no to earrings that dangle. And then yes, in a whole year, only have 2 weeks break. You have only 2 weeks break during December season. Any other break you have is the break you get after every exam. And we have one exam in a year. One exam in a year, that is, you'll be taught all through, and then you have one exam to write, not knowing where the questions are to come from. So that means you have to keep on reading. As a teacher, you just keep reading so that you remember, because as the exam will be set, they won't tell you, is this first, is this part, is this, no. You just read cumulative reading. That's just a briefing of the whole nursing school process. Now to the nursing practice proper. Being a nurse since 2018, I've worked in different places. For a fact, nursing is a lovely job. Nursing is so lovely, it's a lovable job. And some days you feel like, if I'm not a nurse, I'll not be any other thing. Like, nursing is my passion. Nursing is my calling. Nursing is my job. Nursing is my passion. Nursing is my love. There are some days you'll be happy when you meet certain clients, when you meet certain patients, when you treat certain people. You come and make friends along the line. Nursing takes you to lots and lots of people. It takes you through various stages and phases of people's life. People that appreciate your work, meet people that end up telling you personal things that because of the kind of relationship you end up creating with such ones. Like, nursing is really, really a job that gets you emotional at times. It makes you love it. Sometimes it makes you feel so happy. In fact, the passion will be burning at times. You feel like, if it's not nursing, it's nothing else. There are many days like that. So I would say the journey of nursing is an up and down journey. I'll take that again. The journey of nursing is an up and down journey, because there are some days you're high, as I already explained, you'll be so elated. Imagine having to nurse your patient, seeing them now well, strong again, and then leaving. You'll be so happy. You'll be like, hi, I've added value to this person's life. I've done a tremendous thing. Like, you'll be so thrilled, you'll be happy and all. Another side of nursing, there are some days that nursing can get you all gloomed up. It will be so gloomy that you can't even explain why. You're not just feeling happy, you can't even explain why. There are some kind of cases that you handle that gets to you. Some kind of cases that makes you emotional, but still you have to act strong and act as though it's not getting to you. But we are humans. There are sometimes that when you go home, you just start thinking of the situation that just happened. Sometimes you end up calling your colleagues and like, what is happening? How is the patient's condition now? There are some people you meet, you feel so much for them that if it were within your power to help them, you would have done that. If it's within your power to take away the sickness or whatsoever it is they are going through, you would have done that cost-free. But we are humans. Also, being a nurse, just know, is a leg work. Being a nurse is a leg work. What do I mean by leg work? It means you are going to stand on your feet for as long as demanded. Depending on the unit you are even working, emergency unit, theater, imagine having a procedure that will last for hours. You are on your feet, up and doing. If you are in the delivery room, in obstetrics, neonatal unit, like depending on which unit you are, nursing is a standing job. Your feet hurt so badly at times when you come back from work that you feel like not resuming the next day. You feel like not going back to work the next day. Sometimes your feet feel so heavy and tired that you don't feel like even walking, you don't feel like even walking, you feel like just sleeping. You even contemplate if you have the strength to leave work down to the house. Nursing is that job that juggles different skills at different times. Nursing tests a different side of you at different time. This time nursing expects you to be this, the next time nursing expects you to be that. And then you'll be calculating ahead to the big deal. Notice how nursing is associated with money. Associated with money, right? It's not true in this part of the world. If it is money you are dreaming of, if it is money you are thinking of getting, then nursing is not the job here in Nigeria. Because the work you do and the pay you get is nothing commensurate, it's nothing comparable. Like, the gap is so wide. So if it's money that is your motivation to be a nurse here in Nigeria, then nursing is not the place for you. If you are after making real good money, nursing is not the job for you. Also, you hear they say, thank God it's Friday, right? Thank God it's weekend and all. Just know you don't know no Friday. You don't know no weekend. You don't even know day, you don't know night. Because you're at work whenever. Holiday, so you don't know that one too. Because it is wherever your duty falls, that is when you'll be at work. And then justice, for a fact, nursing is a caring profession. It's a caring profession. But the treatment you get, just know you will not get fair treatment at all. Also, Self-talking. There are many days that you have to sit and talk to yourself if you are a nurse. Oh, you think and see what is really happening in my life. Is this the life I chose? Because you get so exhausted. You get so exhausted sometimes that you don't have strength to do nothing. Your social life have been affected because you don't even have much time to socialize. In that you be so tired from work, you end up coming back having little or no energy to interact with people. So your social life will suffer except you have extra the energy. Your rest. See that I used to sleep in the afternoon, I always nap. Nothing don't know nap. If you cover shifts that run 3 shifts, either morning, afternoon, or night, doesn't matter what you love doing because when you are required to be at work, you will report. So say bye bye to your daytime sleep. Even your night sleep on your bed, you're going to say a big bye to it because you're on 90T, you just have to work. And then you interact with many professionals, other professional bodies in the health setup to care for your patient. There are many times that what you think is happening to your patient is not what is happening to your patient. Many times that you end up having clash of interest with either your patient, the other health professionals, or sometimes even health relative. Talking about patient relative are those that follow a patient to the hospital. People that stay over to help do one or two things to the patient. At times, those people even feel they know more than you. So you have battle to fight at times with those people because they are there as the nurse telling your patient that, see this, not knowing that the patient relative is telling the patient something else. That is for those that are even calm. The ones that will now come face to face with you so that let's contend this. Those ones too, they are there. And I say, no, that is not how it is. Some will say that is not how my doctor said. You'll be like, oh really? You'll be surprised, you'll be wondering, if not for professional ethics and guidance sometimes, you nearly lose it. You feel like losing it because some people's attitude will really get to you. And another thing, the image of nursing in Nigeria is down. Like it's so bad that whenever people hear that something bad befalls a nurse, they are happy, not minding who is at fault, what caused it, or what could have, like they don't mind anything at all. They're just happy that something bad befalls a nurse because they just feel all nurses are bad. You see why we the new generation nurses have a lot of work to do. Truly, the image have been bad, but we have opportunity to recreate the story. Talking about dieting, you can't always stick to a good food timing. It's not as if each day you are at home at a particular time. Because of the change in time, it will affect your routine, either your diet routine or even your exercise routine. You can't keep up with an actual routine. Most of the plan you'll be having is a more flexible plan. For instance, let's take exercise. You can't say every morning I'll be doing this time to this time because tomorrow you'll be on night duty. The next day you'll be off. The next day you'll be on morning. So it keeps changing. For that, maintaining a regular routine might be something difficult. Also, depending on the setup you are in, if you're in the government setup, you have more time to be able to rest, more time to travel. But if not, if you're in the private sector, then traveling, just keep it aside. You're already traveling for very, very, very important reason. Because you have only annual leave to use for your travels. Because your off won't be enough. So these are the few things you just need to know before you dive into the profession. We'll subsequently be coming up with more tips. Don't forget to give this video a thumbs up. Leave a comment on the comment section below. Subscribe to my channel and turn on the notification bells so that you get notified whenever I upload. Click on the next video. Thanks for staying true all through. Until some other time. For now, bye.